Hey guys, Tony Maritato here, licensed physical therapist, and today I want to talk about prone extension. So if you're struggling to increase extension specific range of motion, meaning getting the knee straight, one of the common exercises prescribed is called prone extension. Prone just means I'm laying on my stomach. Extension just means that the knee is hanging down into a straight position. I find that prone extension can be uncomfortable for a lot of people. If you have spinal stenosis or any kind of low back issue and you're just not comfortable on your stomach, this is not the best exercise for you. But if you are somebody who can tolerate this position, even enjoys this position a little bit, just spending a couple minutes every day in prone extension can be a huge benefit to letting gravity pull that knee down and straight. Now, some of the tips to look out for: if I have a footboard at the bottom of my bed, I probably don't get full extension here because my ankle is going to be hitting the bed. So what I might do is turn sideways and go perpendicular to the orientation of the bed. So I'm laying horizontally across so my foot can hang off. If this feels too easy, as I slide back, I can let more of the lower leg hang off the bed. In this case, I also eliminate any pressure that's on the incision. Some patients have real sensitive incisions. So if you come down further, now I'm not even touching the incision following the total knee replacement. If this is too much, my low back or my hips or other parts of my body can't handle it, I can come over to the edge of the bed, put one leg down, leave the leg that I'm stretching up. And effectively what I'm doing here again is I'm just letting gravity kind of pull me down into extension. If I need a little bit of relief, I can bend the knee into flexion. This is one of those exercises that you would typically do 3 to 5 minutes in the beginning. You would build up to 10 to 20 minutes. 20 minutes will be a full session. And if you can tolerate comfortably 20 minutes in this position, or you don't want to wait that long, what you can also do, hopefully you guys can see it in the camera, is I can cross my non-surgical leg on my surgical leg. And what this does is it gives me a little bit of extra pressure so that the knee gets pushed into extension just a little bit more. Now, some important dosing options. Dosing just means how much of this you're doing. Don't do so much that it hurts. As soon as you cross that threshold, there's a big difference between discomfort and pain. Once you cross the threshold into pain, you're not going to gain any benefit. Your body is going to resist. Your body is programmed to avoid pain. If it's uncomfortable, no problem. Most of my patients can tolerate what we call discomfort. Only you, the patient, knows what discomfort means, and that could change day to day. On Monday, something like this with my other leg on top could be uncomfortable but tolerable. On Tuesday, it could be miserable. Don't do it once it crosses the threshold into pain. So one more time, 2 to 3 minutes in the beginning, build up to 10 minutes. If you really feel comfortable in this position, you can go 20 minutes. I think this is a great option for somebody who is comfortable laying on their stomach. For everybody else, I'll create more videos and I'll show you other ways to work on extension. Thanks for watching.